Good day, dear colleagues, and I present you the result of our research, morphological aspects of skeletal muscles regenerations under chronic hyperglycemia conditions. Today, the process of muscles regenerations is divided into several stages: necrosis, inflammations, regenerations, remodeling, and functions. Functions repair. The basis of muscles in the activations, differentiations, and fusions of myocytolytocytes and different organs, including skeletal muscles. Chronic hyperglycemia is one of the most common metabolic disorders worldwide, and it is often associated with development of secondary complications and decreases, including the skeletal muscles. Studies have shown that chronic hyperglycemia decreases metabolic capacity of the muscles, decreases the capillary amount and induced atrophy. Also, chronic hyperglycemia impairs the functions of satellite cells. So the aim of our research was to study features of post-traumatic skeletal muscles regenerations in rats with chronic hyperglycemia. The following materials and methods were used in the work. 19 laboratory white male rats were used for study. All animals were divided in 3 groups. Control groups, animals with mechanical damage of skeletal muscles. Experimental groups, rats with chronic hyperglycemia along with mechanical damage of skeletal muscles. And hyperglycemia control groups, animals for glucose homeostasis assessment. The morphological features of triceps surae muscles regenerations were studied at 3, 7th, 14th, and 28th days after injury. During 2 weeks, rats of first and third groups under fructose solutions instead of drinking water. Then intraperitoneal injections of streptozotocin and nicotine acid was performed, and rats of control group received drinking water. For histological and morphometrics analysis of skeletal muscles regenerations, we have used light microscopy. All muscle fibers were divided into 3 types: normal muscle fibers, damaged muscle fibers, and regenerations muscle fibers. So we have resolved the following result. The result of blood biochemical analysis of control rats and animals with chronic hyperglycemia are shown. Experimental rats had significantly higher fasting glucose and decreased insulin content. The C-peptide did not differ between compassion groups. Obtained change largely correspond to diabetes mellitus type first phenotype. Morphological analysis of muscles regenerative process of control group on 3rd day after injury revealed the defect was infiltrated by erythrocytes, fibrofilaments, fibroblasts, and the white blood cells. In animals with chronic hyperglycemia, the defect site was filled with inflammations, dendrites with the large numbers of leukocytes and fat cells. The morphometrics analysis has shown that damaged fibers number in experimental rats was high compared to control animals. No regenerated muscle fibers were identified at this stage. At the 7th days after injury in the control group, the muscle fibers of perinecrotic zone and disorganized perivasal edema was observed. In the study group, there was the significant growth of connective tissues in defect site. At the same time, fat cells, erythrocyte, and leukocyte infiltrations were stored. The morphometry result showed the damaged fibers number of experimental group animals was increased. The regeneration fiber number in experimental rats was smaller. On the 14th day, the muscle regeneration of control animals was filed with myogenic cells located among the beams of collagen fibers and fibroblasts. The increased fibroblast synthetic activity was observed in defect site of triceps muscles of experimental animals. Microvessels germinations occurred more intensively compared to previous term. Morphometric analysis has revealed that damage fibers number in rats with was filed with connective tissues muscles regenerations with connective tissues predominance. Further development of myogen cells into myocytoblast did not occur. On the 28th day of the study, the muscles defects site of chronic hyperglycemia, rats with filed with fragments muscle fibers, numerous vacuoles, leukocytes, and connective tissues. The signs of post-traumatic myogenitis were observed in marginal areas of defect. The damaged muscle fibers number in chronic hyperglycemia rats was significantly higher. The regenerated fibers number in experimental rats was less. Morphometric analysis also showed that the total area of regenerated muscle fibers in rats with chronic hyperglycemia was significantly lower compared to animals without metabolic disorders in both observations areas. Thus, the main structures manifestations of skeletal muscles post-traumatic regeneration process in rats with chronic hyperglycemia are incomplete myogenesis, excessive connective tissues development, new vessels formations disorders, reduction of regenerations muscles fibers amount and areas along with significant increase of damaged muscle fibers numbers. This study is the part of the project supported by Ministry of Education and Science of Ukraine. The results are published in one article. Thank you for your attention.
Thank you for your report. And I have first question. As we know, there is impairment scar formation in case of skin diabetic ulcers when we have diabetic foot, so-called, and there is no proper connective tissue formation. And you have mentioned that it was significant connective tissue development during muscle regeneration. So how can you explain this difference when in the skin we have lack of connective tissue and lack of healing process because of lack of connective tissue and a lot of connective tissue in muscles?
Thank you. Good questions. Because by because by in muscles is data and blood supply and more vessels.
Okay, and maybe a related question we have from the chat from Professor Zablitsev. And what is the reason from the damage of angiogenesis in diabetes and how it affects the process of regeneration of muscle fibers? So if you mean that the difference between connective tissue development is because of different blood supply, so what about angiogenesis if it's impaired in diabetes mellitus, both in skin and muscles? So what can you tell us about damage of, impairment of angiogenesis?
Okay, it's the angiogenesis was superior, and this we had less amount of new vessels, and it's all.
But the question, what about the reason? Can you explain the impairment of angiogenesis? Why is there less vessels because of diabetes mellitus in case of muscle regeneration?
No, because we have activations and chronic hyperglycemia, different deletions of basal membranes.
Okay, thank you for your answer. And the next question is, which of the scientists was engaged in similar studies?
Studies.
Which of the scientists was engaged in similar studies?
This is a good question, but no, we scientific editions.
Thank you.
Let's go to the next question from the chat. We have a question from Professor Panova Tatiana Ivanovna. What is a practical application of the results of your research? What can you recommend?
Repeat, please.
What is the practical application of your results? What can you recommend? How can you use the obtained data?
Okay, research the information which allow to that patients with diabetes.
Okay, and the question from Volodymyr Panchenko. What molecular mechanism can explain the negative effect of chronic hyperglycemia on skeletal muscle regeneration?
Chronic hyperglycemia induces the oxidative stress in solidate and chronic hyperglycemia inhibition, the VNT pathway cells activations. And important for satellite cells activations.
Okay, and the next question from Antsupa Vyacheslavona. What were the criteria for distinguishing the normal muscle fibers from regenerating and damaged ones? Can you describe maybe how you differentiate the normal, regenerating, and damaged one?
Where the normal muscle fibers, these cells that periphery and where regeneration muscles fibers, we have cells nucleus center.
Thank you. I have some question. Excuse me, I have a question. What was the standardization of injury severity while performing surgery on muscles? What was the standardization of injury severity while performing surgery of muscles?
The size of wound was all.
Thank
I think
one minute.
maybe I can help you. I think Vita Vyacheslalovna meant that what was the technique, how you standardize the cut. So you can cut deeper or not so deep. So what was the standardization of your methodics? Because depending on the severity, the morphological picture can be different, right?
With a long trauma of the muscles triceps and make the incisions of muscles.
Don't worry, thank you.
Okay, and one more question from the chat from Taras Bulashkiv. Which muscle was examined, fast or slow, and does it matter?
Repeat, please.
Which muscle was examined, I'm sorry. Fast or slow, and does it matter?
Triceps sure.
The physiological types of muscle fibers, fast muscles and slow muscles. Which types?
Fast muscles.
Fast muscles. Okay, thank you for your questions. Are there any more questions?
Yes. What type of diabetes, first or second, was modeled in your research, and why?
No, we have the first diabetes. Second.
And why did you use streptozotocin model of diabetes mellitus? And how you can say, did everyone develop diabetes? All animals enter in diabetes or no?
Because streptozotocin is inhibitions antibiotics and inhibitions beta cells pancreas, but we have small streptozotocin and nicotine acid. They stimulated pancreas and their hormones, and we have the highest insulin, and this is a standardizations procedures. This is standardization procedures.
Thank you.
Okay, thank you for the discussion. If there are no more questions, we can go forward. Are there any more questions? Okay, thanks a lot.